Greetings, everyone. My name is Amber Reed, and I serve as the Assistant Director in the Office of Data Science and Health Informatics at the National Eye Institute. So today I'm excited to share an overview of this challenge, and it was an initiative aimed at advancing eye care and ocular imaging research by leveraging the OHDSI network. But before diving into the winning projects, I want to take a moment to explain how this effort was structured. So in this initiative used the challenge or prize competition mechanism, which is distinct from traditional funding mechanisms that we typically use at NIH, like grants, co-op agreements, or contracts. So with grants, you propose an idea and receive funding to execute it. But with a challenge, the award prizes are based on the work that has already been completed. So it's just a powerful tool that federal agencies can use to surface innovation and reward real-world impact. Next slide. All right, so the winning teams. So we were thrilled to award 4 outstanding teams. They each received $250,000 for their visionary contributions. So a submission from Mass Eye and Ear, led by Michael Boland, focused on expanding ophthalmic data in OMOP across US and UK institutions, along with detailed documentation and mapping tools. We have a team led by Michelle Rebar from Oregon Health and Science University that is building tools to integrate imaging and clinical exams into OMOP. This basically they see paving the way for AI and federated learning in eye care. Next, we have George Ripsack from Columbia, who is using the OHDSI data to characterize ophthalmic medication use and to track the adherence and any adverse events. And lastly, we do have Dr. Srinivasan from Stanford, who is creating a pediatric eye research network by converting PedsNet data into OMOP format. Next slide. So NEI also recognized 2 excellent submissions with honorable mention awards. Johns Hopkins did propose a study on equitable treatment for diabetic macular edema using the OHDSI data to explore any disparities in care. And Columbia University proposed a privacy-preserving AI tool to detect thyroid eye disease from facial imaging, which is a compelling use of federated learning. We were truly impressed by the level of interest and engagement that we had for this challenge. And while I can't share the exact number of submissions, I can say it was in the double digits, and narrowing the field was a real challenge for us because there really were so many strong proposals. Next slide. For transparency's sake, and because I do anticipate that we'll be using this type of mechanism for future initiatives, I would just like to quickly walk you through the evaluation and judging activities. So to ensure a fair and thorough evaluation, the submissions were first reviewed by an expert panel with deep expertise in everything from clinical informatics, ophthalmology, data science, and even statistical modeling. Their job was to really assess innovation, the feasibility, and the potential impact on the OHDSI ecosystem for vision research. We are extremely grateful for their thoughtful review and guidance in identifying the strongest proposals. And you'll see up on the screen the 4 expert evaluators that we use were Asaya Lin, Patrick Ryan from OHDSI, Brian Stagg, and Mark Suchard. Next slide. And then following the expert review, the top proposals were then scored and ranked by a group of federal judges made up of NIH leaders with expertise in clinical research, epidemiology, data science, and vision health. This panel was really important because it ensured that our selections aligned with NEI's mission and the NIH scientific priorities. And so we did have program officers James and Azadeh from NEI, Jonathan Pollock from NIDA, and Ken Wilkins from NIDDK. And I'd like to just close by acknowledging the essential role of these judges and expert reviewers. So these individuals contributed their time and expertise without compensation or any type of honorarium. and yet their impact on research advancement is invaluable. Looking ahead, we are exploring other ideas for future challenges in this space and in continued partnership with the OHDSI network. We do hope to move those efforts forward, but as I'm sure many of you know, we have been navigating just a few uncertainties at NIH right now. But we are looking forward to what we may be able to do in the future. So thank you all again for your interest and support in making this initiative a success. And I'm really looking forward to what we may be able to do in the future. All right, thanks.